As the human body ages, nearly every organ system undergoes physiological changes, and the brain is no exception. In older adults, the brain becomes more vulnerable to chemical imbalances, reduced blood flow, and altered neurotransmitter activity. At the same time, many seniors rely on multiple medications to manage chronic conditions such as high blood pressure, diabetes, insomnia, anxiety, pain, allergies, and heart disease. While these medications may be medically necessary, some commonly prescribed drugs can unintentionally interfere with brain function and, in certain cases, accelerate cognitive decline or trigger dementia-like symptoms. One of the most important factors behind this risk is age-related changes in drug metabolism. As people grow older, the liver and kidneys, organs responsible for breaking down and eliminating medications, often work more slowly. This means drugs can remain in the body longer, increasing their effects and side effects. A dose that is safe for a younger adult may be too strong for a senior, even if it was previously tolerated well. Over time, this accumulation can affect brain chemistry, leading to confusion, memory loss, slowed thinking, and impaired judgment. A major group of medications associated with cognitive decline in seniors is known as anticholinergic drugs. These medications block acetylcholine, a neurotransmitter that plays a crucial role in memory, learning, and attention. Acetylcholine levels are already reduced in individuals with Alzheimer's disease and other forms of dementia. When seniors take medications that further suppress this neurotransmitter, the brain's ability to process and store information can decline rapidly. Anticholinergic drugs are commonly found in medications used to treat allergies, bladder problems, motion sickness, depression, and even some over-the-counter sleep aids, often without seniors realizing their cognitive risks. Another high-risk category includes benzodiazepines and sedative hypnotic medications, frequently prescribed for anxiety, insomnia, and muscle relaxation. While these drugs can provide short-term relief, long-term use in older adults has been strongly associated with memory impairment, daytime drowsiness, slowed reaction time, and increased risk of falls. More importantly, prolonged exposure can disrupt normal brain signaling pathways, potentially accelerating cognitive decline and increasing the likelihood of dementia. In many cases, seniors continue using these medications for years without regular reassessment, unaware of their long-term neurological impact. Strong pain medications, particularly opioids, also deserve careful consideration. Opioids affect the central nervous system and can cause sedation, confusion, and impaired concentration. In seniors, even moderate doses may lead to episodes of delirium, sudden changes in mental status characterized by confusion, disorientation, and difficulty focusing. Repeated or prolonged episodes of medication-induced delirium are now recognized as a significant risk factor for long-term cognitive decline and dementia. While pain management is essential, it must be balanced with protecting brain health. Another often overlooked issue is polypharmacy, a term used to describe the simultaneous use of multiple medications. Many seniors take 5, 10, or even more medications daily. Each additional drug increases the risk of interactions that can amplify side effects, including those affecting the brain. Some medications may individually pose only a small cognitive risk, but when combined, their effects can become substantial. Polypharmacy is one of the strongest predictors of medication-related confusion and dementia-like symptoms in older adults. It is also important to understand that medication-induced cognitive decline can closely mimic true dementia, making diagnosis challenging. Symptoms such as forgetfulness, difficulty following conversations, trouble managing daily tasks, personality changes, and disorientation may appear gradually. Families and even healthcare providers may mistakenly attribute these changes to normal aging or irreversible neurodegenerative disease. However, in many cases, the root cause is medication-related and therefore potentially reversible if identified early.
Scientific studies have shown that seniors exposed to high cumulative doses of certain medications, especially anticholinergics and sedatives, have a significantly increased risk of developing dementia over time. While not every individual will experience severe effects, the overall evidence strongly supports the need for caution, particularly with long-term use. Importantly, the risk is not limited to prescription drugs. Over-the-counter medications can be equally harmful when used regularly without medical supervision. This does not mean that seniors should abruptly stop taking medications. Sudden discontinuation can be dangerous and may worsen underlying medical conditions. Instead, the key message is awareness and proactive management. Seniors, caregivers, and healthcare professionals must recognize that medications can have powerful effects on the aging brain. Regular medication reviews, dose adjustments, and consideration of safer alternatives can significantly reduce risk. In clinical practice, many cases of confusion, memory loss, and cognitive decline in seniors improve once problematic medications are reduced or discontinued under medical guidance. This highlights an essential point. Not all cognitive decline in older adults is permanent or inevitable. Some forms are medication-related and potentially preventable. In conclusion, while medications play a vital role in maintaining health and quality of life for seniors, certain drugs can unintentionally accelerate cognitive decline and increase the risk of dementia. Age-related changes in metabolism, sensitivity of the aging brain, anticholinergic effects, sedatives, opioids, and polypharmacy all contribute to this risk. Recognizing these dangers is the first step toward protecting brain health. Thoughtful prescribing, regular review, and informed decision-making can help ensure that medications support, not compromise, cognitive well-being in older adults. One of the most dangerous aspects of medication-related cognitive decline in seniors is not the medications themselves, but how early warning signs are misunderstood, minimized, or completely ignored. In older adults, changes in memory, thinking, or behavior often develop gradually. Because aging naturally brings mild forgetfulness, both families and seniors may assume these changes are normal, delaying proper medical evaluation. Unfortunately, this delay can allow temporary and reversible medication side effects to progress into more serious and sometimes long-lasting cognitive impairment. In the early stages, medication-induced cognitive problems are often subtle. A senior may begin misplacing items more frequently, repeating the same questions, struggling to find words, or taking longer to complete familiar tasks. These changes may come and go, especially after starting a new medication or increasing a dose. Because the symptoms are inconsistent, they are often brushed off as stress, fatigue, or simple aging. However, these early fluctuations are actually a key warning sign that the brain is reacting negatively to a medication. Another common early symptom is confusion, particularly about time, place, or routine. Seniors may forget appointments, mix up days of the week, or feel disoriented in familiar environments. When these changes appear shortly after a medication change, they should raise immediate concern. Sadly, this connection is frequently missed. Mood and personality changes are also important but overlooked indicators. Certain medications can cause increased irritability, anxiety, depression, emotional flatness, or even apathy. A previously social and engaged senior may become withdrawn or uninterested in activities they once enjoyed. Because emotional changes are common in later life, they are often attributed to loneliness, retirement, or physical illness, rather than medication effects. Yet the brain's chemistry plays a central role in emotional regulation, and medications that interfere with neurotransmitters can significantly alter mood and behavior. One of the most serious early warning signs is delirium, a sudden and noticeable change in mental status. Delirium may include severe confusion, agitation, hallucinations, or extreme drowsiness. It often occurs after starting a new medication, during hospitalization, or when multiple drugs interact. While delirium is sometimes reversible, Repeated or prolonged episodes are associated with a higher risk of long-term cognitive decline and dementia. Unfortunately, delirium is often misdiagnosed as dementia itself, leading to further inappropriate treatment rather than addressing the underlying cause. A major reason these warning signs are ignored is the widespread belief that cognitive decline is an unavoidable part of aging. While mild slowing of memory can occur with age, significant confusion, disorientation, and functional decline are not normal. When these symptoms appear, especially rapidly, medication side effects should always be considered as a possible cause. Failure to recognize this can result in seniors continuing harmful medications for months or even years. Another critical issue is that many seniors are reluctant to report cognitive symptoms. Some fear being labeled as having dementia, losing independence, or becoming a burden to their family. Others may not recognize the